Hi, my name is Breanne Aylward, and I'm a PhD candidate at the University of Alberta. I'm really excited to share findings from our recent study that examined how news outlets in Canada and the United States are covering climate change and mental health. We know that climate change is leading to a wide range of negative mental health outcomes through at least three pathways. Weather and climate extremes, such as hurricanes, floods, and wildfires, slow onset changes, such as rising temperatures, changing precipitation patterns, and sea ice loss, and vicarious experiences. So through observing the impact of climate change on others, and this might occur through reading or hearing about climate change in the news. Along with potentially impacting mental health, news media plays a crucial role in shaping public discourse and influencing policy. So news coverage can make issues more or less noticeable. And by choosing specific words and images, media can frame the issue and shape how people perceive it. The goal of our study was to examine how news sources in Canada and the United States covered climate mental health impacts between 2016 and 2020. We used a multi-step systematic approach to search for, screen, and analyze articles. And we identified over 1,000 relevant articles. Coverage over the study period was really episodic, so you can see several sharp peaks at key time points. So this peak in September 2019 may have been driven by several events, such as the International Global Week for Future, which was a series of climate strikes that took place in over 150 countries. Unfortunately, you can see that there was a decrease in coverage in 2020, likely because the media was more focused on the COVID-19 pandemic. We found that over 450 news outlets published articles on climate mental health outcomes. However, repeat coverage was infrequent, so each news outlet published roughly 2 articles on this topic over the 5-year study period. This episodic, limited coverage may not be enough to engage the public for an extended period, which hinders the possibility of sparking meaningful discussions or influencing policy changes. We found that roughly 3/4 of opinion pieces presented climate mental health outcomes as legitimate or expressed support for people experiencing these issues. And you can even see this from some of the headlines on the slide. So they emphasize that these emotions are normal and somewhat common. And this is really encouraging as it may signal growing awareness and acceptance of emotional responses to climate change, which could potentially foster greater understanding and societal empathy. Over half of the articles identified at-risk populations, most of which focused on children and young people. Unfortunately, fewer news articles mentioned other groups that research has identified as at risk, such as Indigenous peoples, women, and other groups that are shown in this graph. So along with shaping how decision makers view these groups, this coverage could influence how individuals within these groups perceive their own vulnerability to climate mental health risks. So for instance, if news coverage labels children and young people as vulnerable, without highlighting agency or coping strategies, it could foster unhealthy perceptions and narratives. And lastly, we found that roughly half of the news articles mentioned strategies to deal with climate mental health risks. However, the focus was overwhelmingly on individual actions, such as getting involved with climate activism, reducing personal waste or carbon emissions, or things like going to therapy. And while individual action is important, we need a wide range of strategies to effectively address climate mental health risks. So although we saw some encouraging trends, coverage of climate mental health outcomes appears somewhat shallow. We call for more sustained news coverage that focuses on protective factors, interventions, and coping strategies. This approach has the potential to enhance public awareness and prompt action to reduce climate mental health risks.